morning, everybody. Please have a seat.
I apologize. That was my fault. We can get the wheel here. Half a day?
Half a day.
Oh, we sound so sleepy. What happened? It's not even... Let's start that again. Half a day.
Half a day.
Much better. I'm so glad to have you all here this morning for a proclamation signing proclaiming January 2025 as Cervical Cancer Awareness Month. Before we begin, of course, I want to acknowledge the presence of the Honorable Joshua Tenorio, our Acting Governor of Guam. And to his left, the Honorable Frank Blas, Jr., Acting Lieutenant Governor of Guam. From the 38th Guam Legislature, Senator Tina Munya Barnes. Senator Sabrina Salas Metanani, Health Committee Chair. Senator William R. Parkinson. And Senator Jesse Anderson Buhan. You want to keep those applause going because I have a lot of stakeholders to acknowledge this morning, starting with Public Health Acting Director Peter John Camacho. Our Chief Public Health Officer, Catherine Encao. Our Medical Director, Dr. Bob Lizama. Public Health Bureau of Non-Communicable Disease. Leon Guerrero. Leon Guerrero. Who did I marry? I married you to the mayor, former mayor. Chico, I'm sorry. Maryland. Medical Director, Dr. Bob Leon Guerrero. Let's try that again. Give a round of applause. Let me do that review. Breast and Cervical Cancer Early Detection Program. Give them a round of applause. Comprehensive Cancer Control Program, the Diabetes Prevention and Control Program, Tobacco Prevention and Control Program, Health Disparities Grant and UOG Health Disparities Grant, the Behavioral Risk Factor Surveillance System Program, Hypertension Prevention and Control Project, and the REACH Program. Also from Public Health, Community Health Centers, our Northern and Southern clinics present this morning. Let's give them a round of applause. The Bureau of Family Health and Nursing Services, Women's Health, the Maternal Child Health Program, the STD HIV program, and the immunization program. We also have with us this morning the Guam Comprehensive Cancer Control Coalition. Let's give them a round of applause. Guam Breast and Cervical Cancer Early Detection Program partner providers. They are FHP, GRC, and MDX. Let's give them a round of applause. We also have Guam Seventh-day Adventist Clinic joining us this morning. Half a day and welcome. St. Luke's Medical Center is also with us this morning. GRMC, UOG's Cancer Research Center is also here, and that includes Guam Cancer Registry, the Community Outreach Corps, and Nutrition Program. Also want to welcome Total Guam Foundation, the Health Clinic, the American Cancer Society Guam Chapter, the Guam Cancer Care, the Filipino Community of Guam, the Lions Club International, Keyless Community Foundation, and Cabo Select Care, Breast Friends Forever, Dr. Mariana Cookyan, Barbara Mofness, and Netcare Insurance. Also see a member from the Leon Guerrero Tenorio Administration Cabinet, Ms. Jane Flores, Director of Bureau of Women's Affairs. So now that I've introduced all our stakeholders, so many to list today, I now want to give the floor for her remarks to Public Health, Chief Public Health Officer Catherine Encao.
Crystal. Half a day and good morning. Acting Governor Joshua Tenorio, Acting Lieutenant Governor Frank Blas Jr., esteemed members of the 38th Guam Legislature, cancer warriors, caregivers, honored guests, and everyone joining us today both in person and online. Thank you for gathering here as we proclaim January 2025 as Cervical Cancer Awareness Month in Guam. Your presence reflects the heart of our community, a shared commitment to care for one another and to build a healthier, brighter future for our island. Cervical cancer remains a formidable challenge worldwide, claiming the lives of almost 350,000 women in 2022, with the majority of these losses occurring in low and middle income regions due to barriers in accessing care. Closer to home, it was the fourth leading cause of cancer deaths among women in Guam in 2023. These are more than statistics. They represent mothers, daughters, sisters, and friends whose lives were cut short by a preventable disease. Persistent infections with the human papillomavirus are the primary cause of most cervical cancers. Yet, there is hope. HPV vaccination is a powerful tool in preventing this disease. Sadly, in Guam, only about half of eligible girls complete the vaccination series, leaving many vulnerable. This is a call to action for us all. We have the tools, the knowledge, and the power to protect our community. The World Health Organization's 3-pillar strategy gives us a roadmap to eliminate cervical cancer globally. By 2030, we aim to fully vaccinate 90% of girls by age 15, ensure 70% of women are screened by ages 35 and 45, and provide treatment to 90% of women with pre-cancer and manage 90% of women with invasive cancer. If we achieve these goals, we could witness the elimination of cervical cancer in Guam by the end of this century. Imagine the lives we can save, the families spared from heartache, and the hope we can bring. Cervical cancer is preventable, treatable, and curable if detected early. Together, we can ensure that every woman in Guam has access to life-saving vaccinations too, contributing to cancers like those of the throat and mouth. Protecting our community means encouraging vaccination for boys as well, safeguarding everyone's future. The strength of our island lies in our unity, compassion, and determination. This proclamation is not just words on paper. It is a promise to enhance education, expand access to care, and fight for health equity so that every woman, regardless of her background, has the opportunity to thrive. I want to express my deepest gratitude to our healthcare heroes, advocates, and community leaders who work tirelessly to combat this disease. You are the driving force behind the change we need, and your efforts are truly inspiring. As we honor Cervical Cancer Awareness Month, let us celebrate the survivors, remember those we lost, and renew our commitment to eliminate cervical cancer from our island. Talk to your loved ones, get vaccinated, schedule your screenings, and encourage others to do the same. Together, we can protect our families and save lives. Thank you for being part of this vital mission. Together, we can and will make a difference. Si Diyos maasi.
Thank you so much, Ms. Catherine. The next speaker is actually not joining us in person. I want to draw your attention to the screen. This next message comes from Dr. Neil Palafox, University of Hawaii, Pacific Against Cervical Cancer Project.
Happy Day, Acting Governor Tenorio, Acting Lieutenant Governor Blas, members of the 38th Guam Legislature, cancer survivors, caregivers, guest speakers, partners in the community, and viewers streaming live. Since the year 2000, there have been exponential advances in the science and technology for cancer prevention and treatment. The world now has the medical technology and means to eliminate cervical cancer. No woman should suffer or die from cervical cancer. To deploy the new technology, the World Health Organization has launched an Eliminate Cervical Cancer initiative in 2020, using 3 strategies. Number 1, 90% of girls should be fully vaccinated with HPV vaccine. 2, 70% of women are screened with a high-performance test. And 3, 90% of women identified with cervical cancer disease should receive treatment. Elizabeth Guerrero, the head of Guam's Breast and Cervical Cancer Program, and Dr. Dolores Lee, Medical Director of Total Foundation, and I attended the ECC conference in Australia. We learned of the amazing accomplishments of cervical cancer control in Malaysia, India, Papua New Guinea, and Australia. I provided a presentation on the progress of cervical cancer control in the USAPI. The PACE project, funded by the CDC and POA, which looks to eliminate cervical cancer in the USAPI, began as a concept in 2010 by the Cancer Council Pacific Islands and was initiated in Guam in 2019. It was initiated in partnership with the government of Guam, the Northern Community Health Center, Total Guam Foundation, FHP, MPG, SDA, Guam ACS, Guam Cancer Coalition, and the University of Guam Cancer Center. We partnered with the National Cancer Institute, the CDC, and the University of Hawaii. There's been tremendous work towards eliminating cervical cancer in Guam. If the current effort is maintained to deploy primary HPV screening strategy and to intervene with colposcopy and treatment in Guam, we will be able to achieve the 3 pillars by 2030 and thereby achieve the WHO elimination target and cases by 2050. What this will do, it will decrease the number of new cases by 40%, decrease deaths by 35%, and decrease the cost of cancer screening and treatment by 22% in Guam. Thank you for allowing me to be part of the PACE project and be part of the important cervical cancer elimination strategy in Guam.
Please keep your attention to the TV. We now have a message from Dr. Dolores Lee, Medical Director for Total Guam Health Clinic.
Buenas Tenhafadini. I'm grateful to be joining you to celebrate cervical cancer awareness. If we work together to spread the word that cervical cancer is preventable and can be eliminated during our lifetime, then no woman will be left behind. No grandmother, mother, sister, or daughter will ever have to hear that they have cervical cancer. No family member will ever have to hear that their loved one has cervical cancer. So how do we go about achieving this goal of an island and a world in which cervical cancer is eliminated? We do it through 3 strategies: vaccination, screening, and treatment. Before I get into these strategies, let me talk about cervical cancer and its main cause. Did you know that the majority of cervical cancer cases are caused by viral infection? Yes, the majority of cervical cancer cases are caused by HPV, the human papillomavirus. The good news is that we have a vaccine for HPV, a vaccine that protects against 6 different types of cancer. In addition to cervical cancer, the HPV vaccine protects against oropharyngeal, vaginal, vulvar, penile, and anal cancer. It also protects against genital warts. I remember being in my undergrad immunology class where we were given an assignment to discuss what we each thought would be the immunological breakthrough of our lifetime. One of the proposed developments was a vaccine that protects against cancer. And as you have heard me just say, this immunological breakthrough has happened in the HPV vaccine. I share this with you as evidence that groundbreaking developments can happen in our lifetime, like the HPV vaccine. So let us be encouraged and believe that we can eliminate cervical cancer in our lifetime if we work together to achieve our goals of 90, 70, 90 by 2030. What does 90, 70, 90 mean? It means that 90% of girls will be fully vaccinated with the HPV vaccine by age 15. 70% of women will be screened using a high-performance test by the age of 35 and again by the age of 45. And 90% of women with precancer will be treated, and 90% of women with invasive cancer will be managed. So please make it a point to discuss the HPV vaccine and cervical cancer screening with your doctor. Please encourage all the women in your life to talk about the HPV vaccine and cervical cancer screening with their doctors. And when offered the HPV vaccine for yourself or family member, please say yes. Please say yes to protecting yourself and your loved ones against cancer. Let us work together to ensure that no woman will ever have to be diagnosed with cervical cancer, that no woman will be left behind, because even just one woman with cervical cancer is one woman too many. Cesar's Moxie.
And now back to the room. We have Miss Naomi Del Mundo from the Guam Cancer Registry.
Hafade Acting Governor, Acting Lieutenant Governor, members of our legislature, cancer warriors, survivors, community partners, everyone. Again, I am Naomi Del Mundo with the Guam Cancer Registry. I would like to thank the organizers for inviting the registry to speak about cervical cancer data. It's always an honor. According to our data, cervical cancer is among the top 10 cancers diagnosed in women on Guam. Over the past decade, we've seen a slow but steady decrease in the rate of cervical cancer cases in Guam. Between the years 2018 and 2022, Guam recorded 24 cases of invasive cervical cancer and 38 new cases of in situ or precancerous cervical cancer. Among those cases, Chamorro and other Micronesian women have the highest rate of incidence on Guam. 71% of cervical cancers, both invasive and in situ, were diagnosed before the age of 50. Good news is that more patients are being diagnosed at the precancerous stage than the invasive stages and are getting treated earlier. With that said, we should remain vigilant with our screenings. At least 50% of cancer patients that were found to be diagnosed with invasive cervical cancer were typically found at a late stage, stage 3 or 4, which makes our battle for treatment even more difficult. That is why we always advocate for early screenings. The earlier cancer is found, the greater the chances of beating and surviving cancer. Again, we at the registry would like to thank our community partners, legislature, and everyone for their continued support. For more cancer information on Guam, please feel free to call us at the registry at 671-735-2988. Thank you.
Thank you so much, Ms. Naomi. And now I want to give the floor to the Honorable Acting Governor of Guam, Joshua Tenorio.
Good morning, everybody. Welcome to Adeluc. And I want to first recognize all of the cancer warriors and the survivors of those that we've lost to cancer. The kind of work and volunteerism that we see from cancer warriors and family members is unmatched. And many times, those of us that are part of this team get our inspiration and our motivation and our energy from the work that you're doing. And I just want to recognize what an important role that you play here. We heard some promising data with the decrease in cases, but the reality is we're living in a very, very different and difficult time. More people are skeptical of vaccines now after COVID than there ever were before. There are still large portions of our population that especially are dealing with a lot of socioeconomic challenges that don't have regular access to healthcare. Those are all challenges that many of us are very focused on eliminating and addressing. But it does take a team. The government can't do it alone. Healthcare providers can't do it alone. But with that energy that we get from those cancer warriors and the family members and from those that are really involved in the science, we really can make some great gains. Earlier, Crystal talked about all the different programs that are here. And when we work in as a team, there are many entries to try and identify and screen and get people to encourage them to come in and get services. There are other conditions that make it even more difficult for people that are susceptible to cancer. Smoking cigarettes, having unhealthy lifestyle choices, or I think the worst is just avoiding medical care and screening. Those are all not only risk to yourself, but risk to others. So I just want to say that working together as a team, and today we're able to give the general public some information and some focus on the work that needs to be done. And for that, I want to recognize the leaders in the movement. Those folks, especially the program managers, there are a lot of unsung heroes that are out there in the front line, including all of the medical folks and the people that work for medical folks, right? I mean, the people in the front areas of clinics, those that are providing transportation, those that are providing patient care. Everybody has a role to play as we battle and move to try and eliminate by 2030 cervical cancer. That is a realistic goal, but it's going to require a lot of our hard work. And I know, given the entire room is filled, that we are up to the chance and to the task. So let's work together. Let's continue this great work, and let's celebrate the work that we're going to be doing on behalf of all the women and girls on this island. Sejus Masi.
Jesus Masi, Acting Governor. I now want to give the floor to our Acting Lieutenant Governor of Guam, Frank Blas Jr.
Thank you very much, and thank you for all you being here today. You know, my job is simple. All I have to do is say "ditto." But really, as a member of a family that had to experience the tragedy of cancer, and in that trial, the work that was done and the assistance that was provided, not just to my father, but to the family. I just want to say thank you very much. I've seen your work. I know what your work is. Thank you very much for it. I heard about the challenges that we have, and please, it's a challenge that's very attainable. We can attain that, and I know that it can be done. As a former president of the Make-A-Wish Foundation, along with my former board member, Jackie Marati, the pain that we see, and we would always tell the board members, I said, we work in an organization that one day we hope would never have to exist. And I think that should be the goal for all of us that in here, that we work towards an effort where our services and what we need to provide are no longer needed. And in the case of cervical cancer, where it's not only treatable, it's preventable. If we can just knock that off and focus in on other areas. This is a conversation that we couldn't have 30 years ago. With the strides that we've made and with your continued assistance, support, advocacy, we are going to beat this. And it's an honor to be here today, to be in front of you today, to thank you for all that you've done, and thank you in advance for all that you will do. Thank you very much.
Jesus Masi, Acting LT. I now want to call to the podium for the reading of the proclamation. Our reader today is Ms. Jackie Marati, Guam Cancer Care Board Secretary. Or she can read it.
Thank you very much, Crystal. Good morning and half a day, everybody, and thank you so much for being here. It is an honor to read this proclamation, number 2025-04, a proclamation of the governor proclaiming January 2025 as Cervical Cancer Awareness Month. Whereas every January, our island joins the rest of the nation in observing Cervical Cancer Awareness Month to raise awareness about cervical cancer, increase education about the risks, and encourage women to implement preventive measures against the disease. Whereas in 2022, 660,000 women were estimated to have been diagnosed with cervical cancer, and about 350,000 women died from this disease. Whereas according to the latest data of the Guam Cancer Registry 2018 to 2022, there were 27 invasive cervical cancer cases, which were highest between the ages of 50 and 54 years of age, 7 cases, and 7 identified deaths from cervical cancer. In the same study, there were 39 in situ cervical cancer cases, which were highest among those 25 to 29 years of age. Whereas this year's theme, We Can Prevent Cervical Cancer, focuses on developing strategies to educate women about cervical cancer and prioritizing their health by taking life-saving, preventative actions to minimize risks associated with the disease. Whereas the Guam Breast and Cervical Cancer Early Detection Program, BNC program, has served 1,263 eligible women since 2016 with cervical cancer screening and diagnostic service assistance. Whereas through collaborative programs and data collection among agencies and organizations, such as the Department of Public Health and Social Services and the Guam Cancer Registry, Guam has progressed in preventing cervical cancer on our island. There was a decrease in the cervical cancer incidence rate for invasive cases. 2008 to 2012 data 11.98%, compared to 2013 to 2017, 9.8%, and 2018 to 2022, 7.49%. Whereas cervical cancer is primarily caused by persistent human papillomavirus infections, lives can be saved through various practices such as receiving age-appropriate HPV vaccination, cervical cancer screening, Pap tests and HPV tests, and receiving early treatment. Whereas we stand in solidarity with all those affected by cervical cancer, pay tribute to those we have lost to the disease, and recognize the dedicated advocates, researchers, and healthcare providers who tirelessly work to ensure that cervical cancer prevention continues to be a priority and all those battling the disease receive the necessary support.
Now therefore, I, Joshua F. Tenorio, Octumega Lahing Guahan, Acting Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim January 2025 as Cervical Cancer Awareness Month.
In witness whereof, I, Frank F. Blas Jr., Acto Segundo Magalayan Guahan, Acting Lieutenant Governor of Guam, hereby, together with the Acto Magalayan Guahan, cause the Great Seal of Guam to be affixed in the capital city of Agana in the 17th day of January in the year of our Lord, Anno Domino 2025.
Viva Cervical Cancer Awareness Month.
Thank you so much to our reader, and thank you, of course, to our acting governor, our acting lieutenant governor. Because we have such a large group of stakeholders, we're going to do the photo opportunity a little different today. I ask that our panel in the front stay seated but turn around, and everyone else, the photographer, will be up here in front, so just remain looking this way.